Well, hi everybody. Thanks very much for coming this evening. Nice to see you all. My name is Matt Metz, and I'm going to talk to you a little bit about pure body transformation. So this is us, and I am a board certified Cleveland Clinic fellowship trained surgeon. I specialize in minimally invasive surgeries, and I think I'm the first surgeon in the state of Colorado that did a minimally invasive surgery fellowship. So this is one of our patients. And I love this photo because we have a lot of patients that have their before and after pants, and it always just makes me happy to see them getting their lives back. So just a little background on what it is that we do and why we do it. This is the United States in 1990, and you can see that there are a number of white states up there, and those white states are states with no data on obesity, and the blue states are states with a 10 to 14% obesity rate. As you move down from to the 2000s, you see that there are several of these dark blue states, and they have a 15 to 19% obesity rate, and then quite a few beige states, which are states with a 20% obesity rate. Coming down to 2005, we see quite a few red states, which is not a political thing, but these are states that have a greater than 30% obesity rate. And then in 2008, Colorado was the last state to have an under 20% obesity rate. Looking down at 2010, everybody has crossed. So every state in the union has an over 20% obesity rate. And what does that mean? That means that the average weight is about 30 pounds overweight for 20% of the population. That's pretty significant. What's the impact of being overweight? Well, at a personal level, it's about $15,000 per year, which is very expensive. That includes diets, food products, prescription drugs for medical problems associated with weight or weight loss medications. But the national cost is about $200 billion, and that's $93 billion in medical bills and $33 billion in weight loss products and services. The health implications of being just about 30 pounds overweight are pretty severe. So we see a 70% increase in coronary artery disease, that's heart disease leading to heart attack, a 75% increase in stroke, 400% increase in diabetes, a big increase in mortality, and about 400,000 deaths occur every year as a result of complications of weight. So I like this BMI chart. I find it's very helpful for both insurance purposes and just for looking at where people fall in. And I like to pick 5'5" because it's right in the middle of that chart. And if you look at 5'5" and come down to about 180 pounds, that's a BMI of about 30, which is where people begin to qualify for these procedures. There are comorbidities of being overweight. That means medical problems, serious medical problems that can occur as a direct result of excess weight. And they're pretty severe. Things like diabetes, heart disease, infertility, depression, sleep apnea, all sorts of things that we don't want to have but that develop over time with excess weight. Why should anybody even consider a weight management procedure? Well, 95% of people fail diets and medical therapy. In fact, a study just came out last week that was a combination study between the United States and Great Britain, and they showed less than 1% of people that are 30 pounds overweight will lose their weight and keep it off with just diet and exercise alone. Less than 1%. Being 30 pounds overweight significantly reduces life expectancy. In fact, it can reduce a person's life expectancy by 7 to 14 years, which is pretty significant. And weight management procedures can resolve or at least improve most of those medical problems. The most important thing is that the benefits of surgery greatly outweigh the risks. So what are the benefits? There's a lot of stuff here. There's the big things like getting rid of the medical problems, increasing energy, self-confidence, life expectancy, but my favorite things are the last four. So increasing quality of life. I have patients that aren't comfortable in their own skin. They don't want to go to amusement parks. They're uncomfortable on an airplane. They don't like to go to Elitch's or some of the other water parks. They just don't feel comfortable in their own skin. They're concerned about going to a high school reunion, or they're getting back in the dating world and they're just not comfortable with themselves. But it's nice to be able to make people feel jealous that you've lost the weight, to make all these new wardrobe choices that were not available to you before. And my favorite is reclaiming youth. So people that were a certain weight in high school, and no matter what they do, they can't get that weight back, whether it's because they've had children or stresses and life happens, but getting them back to their pre-high school, or not pre-high school, but getting them back to their youth weight is really fun and rewarding and exciting. So weight management procedures are not a cure for weight issues. They're just tools that help treat or control weight, helping people reach their weight loss goals. Right now, surgery is considered the only treatment that results in sustained long-term weight loss. It is not the easy way out. So there's a cartoon here in the corner and it says, weight loss surgery is the easy way out. Said no weight loss surgery patient ever. And it's true, it is not the easy way out. It requires multiple pre-op visits and testing. It can be quite expensive. It requires a commitment to modifications in lifestyle, lifelong vitamins, and you got to see me, which nobody likes to do because I'm mean, but it's definitely worth the effort. So this is the Resolute procedure. And the Resolute procedure is similar to established weight management procedures that are out there, but the difference is it's tailored to the individual's size and needs. And I'm going to talk about that more in a second. There's no foreign object. I'm not putting some plastic thing around the stomach. I'm not rearranging the intestines. There's no need to come back and have something adjusted. It's minimally invasive, and it's about a 45-minute procedure with you asleep. Here's how the Resolute procedure works. It's basically a stomach reshaping. So what I'm doing is I'm removing the stretchy part of the stomach, which reduces the amount of food a person needs to eat to feel full, but I'm also taking out the part of the stomach that makes the appetite hormone ghrelin, and that's really what helps with the head hunger. So you're not feeling that strange craving to eat at odd hours in the middle of the night, some of the grazing behavior that tends to be really tough for a lot of people, especially in stressful situations. What can people expect with the Resolute procedure? Our average weight loss in 6 months has been 48 pounds. Now keep in mind that's with people from a lot of different heights and weights, so you have to bear that in mind with the statistics. But our average weight loss in 12 months, depending on who you're starting with, is about 75 pounds. Now a lot of our patients don't need to lose that much weight, but we have people from all walks of life. So if you have somebody that's 400 pounds or a person that's 160 pounds, if you average their weight loss, that's what we're seeing. The statistical average is 50 to 65% excess weight, which makes, to make the math easy, that means let's say a person is 50 pounds overweight. So 50 to 65% of that is going to be 25 to, 65, to 30 some odd percent. It's going to be 25 to 30 some odd pounds off. My math is not great. It's been a long day. Okay. The diet after surgery, what do you eat afterwards? So the first week are clear liquids. Vodka and tequila do not count as clear liquids. It includes things like clear protein drinks, sugar-free Jell-O, sugar-free popsicles, caffeine-free tea, broth, things like that in the first week. Not so fun, but you're getting full very quickly, and you're really not hungry in the first week after surgery. Week 2, most of our patients go to what we call full liquids. Those are milk or soy or almond-based protein shakes, creamed soups, and Greek yogurt type things. Week 3, we usually have people go to what we call soft selects. And soft selects are fat-free refried beans, cottage cheese, scrambled eggs. And then by week 4, most people are on what we call a modified regular diet. Soft fish, moist chicken, lunch meat, cheese, things like that. By 6 weeks, you're eating regular food, just small amounts, and you're feeling full afterwards. We encourage people to eat their protein first so that they fill up with protein and to avoid carbohydrates, in particular things like bread, rice, potatoes, and carbonated beverages. So the stuff that we probably should be sticking away from to begin with. But the nice thing is now folks have a tool to help them stay away from those things, which is a huge, huge benefit. So what are the risks of the Resolute procedure? The main risks are leak. So anytime you're sewing the stomach or operating on the stomach or cutting the stomach, there's always a risk of leak. Now the leak rate nationally for these types of procedures is about 2 to 3%, but our leak rate at Pure Body Transformation so far is 0. We've been doing this for about 8 years, and the procedure works fantastic, and we have a very, very low complication rate. The other thing that can happen is blood clot. Anytime a person is having surgery, they are at risk of blood clot. We have never had a person pass away. We have had 2 people have blood clots, but they were not associated with this procedure. Both of them did just fine. They just needed to go on some blood thinners for a couple of months. This is an expected thing. One of them had a pre-existing clotting disorder, and the other one was supposed to be on a blood thinner, and it didn't work out. Other things that can happen from this procedure: nausea and vomiting. Anytime we're doing a surgery on the stomach, people can get a little bit of nausea short term. It is managed easily with some medication, and people tend to do just fine after a day or so. Reflux can happen. Excess skin from a lot of weight loss can happen. Hair loss, which is temporary. Gallstones and kidney stones all can happen, but it is extremely rare after these procedures. Does insurance pay for Resolute? In a word, no. This technique is an established weight management procedure used for people with a higher body mass index, usually with a BMI of at least 35. But insurance companies do not recognize this procedure as preventive medicine for people with a lower BMI, even though we know it works. Even though the FDA has already approved the lap banding type procedures for people with a lower BMI, but insurance has not lowered the requirement. So this is an established procedure that we've been doing for many years, but insurance unfortunately does not cover it for people that are smaller. As I mentioned, we have a proven way to help people lose weight that's got a lower complication rate than most common procedures, and even helps many medical problems go away. I've seen how well this procedure works for my heavier patients, and I want to make this life-altering service available to everybody that needs it. How much does it cost? Show me the money. So the price of this procedure includes everything. It's not just me, or I'd have nicer shoes. It includes the hospital, the surgery center if we do it at a surgery center, me, the assistant, anesthesia, pathology. So when we're taking a little piece of stomach out, we got to send it to get tested just to make sure we're not missing something. Nutrition evaluation with our dietitians, both before and after surgery. Mental health evaluation, very important for these procedures. Lifelong support group, and follow-up, but it's still under $13,000, which is a lot of money, but much, much more effective than diets and exercise, which can easily add up to this much after just a couple of years. How do people maximize their success? Basically, it's through motivation, dedication, perseverance, nutritional counseling and support, and meticulous surgical technique. So one of my nicknames in the operating room, and I have many, it's okay, I'm aware of them, is Mr. Dr. Picky Pants, and I'm okay with that. I would like my surgeon to be meticulous and picky and make sure everything is done right. So the most important thing to maximize success is teamwork. And that's not just teamwork for the folks that are working on you, you're a part of that team as well. We want everybody to succeed, and so we need them to work together in a comprehensive environment with our team. What else we got? One of the nice things about our program is that not only do you get to see me, which is a blessing and a curse, I suppose, but you also get to see our nurse practitioner, our mental health providers, our dietitians, all in an interdisciplinary team. We've got long-term support, dietary counseling, psychiatric and social programming. We've got internet-based teleconferencing. What the heck is that? That means for our patients that live out of town, or even we have several that live in other countries, they're able to participate in our support groups and the rest of our program via the internet or via the telephone, so that they can stay in contact with us. We've got electronic health records with patient portal access, so they can email us directly with questions and we can forward their labs to them so that everybody's involved. And as far as I'm concerned, I think we have the best team around. So my favorite part of this whole thing is the before and after pictures. So I just have a couple of folks that I've got here that we're still working on the permission forms. I'm not the best at the legalese, but we've got a couple of our before and after pictures. So here's a before the Resolute, and after. She's doing fantastic. So proud of her. Actually just saw her a couple weeks ago. And then this is one of my favorite pictures in the whole system. So we've got before and then after. So it's a really effective procedure. It works great. People are utilizing several of our financing options instead of just coming out and dumping a bunch of cash. And it's really a very effective, successful, long-term solution to weight issues. So what's the next step? Contact our office either by calling our office on our telephone number or just coming to our website, which is www.purebodyweightloss.com. You can also email our office manager directly at basamanager@gmail.com. Come in, set up a new patient consult. We'll do your dietitian and mental health clearance, and we can help you start on the path to healthier, happier you.